Welcome, everybody, to the No Normal Show for Thursday, August 27th, 2020, brought to you by Revive Health. This is our weekly deep dive into how hospital and health system marketers can navigate what we're calling the no normal. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for the show. I'm joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris.
Good to see you, sir. You must be muting for environmental purposes. I will not call on you again. Sorry. We're also joined by Andy Chang. Andy is the Executive Director of Marketing and Physician Outreach for Piedmont Healthcare, an 11 hospital system based in Atlanta, Georgia, serving over 2.5 million patients and over 800 locations throughout Georgia. He has been at Piedmont for 3.5 years and has over 20 years of experience as a marketer. Hello, Andy.
Hey, how's it going, Chris?
Very good. Good to see you again, sir.
Yeah, you too. Chase, how's it going?
Going well. Good to have you on the show, Andy.
Yeah, thanks. Thanks for having me.
Yes, we're looking to dive in. So we're going to start that conversation in just a second. Some quick notes before we do that. If you're new to the podcast, this is a place where we are sharing industry trends, research, stories, anything we can that we think is helpful for health system marketers and communicators who are navigating what we're calling, again, the no normal. If you want to know more about what we mean by the no normal, key principles of the no normal, check out some blog posts that we've developed. Chase will share those in the chat function. Speaking of the chat function in Zoom, if you have questions for us, for Andy, for myself, for Chase, as we go through today's show, please put those in the Q&A queue in Zoom. That's where we keep an eye out for questions that we want to answer during the show. You can use the chat function, which is separate, to talk to other attendees. Chase, again, will use that to post links if we have them as we go through. But we are not monitoring that, or I'm not monitoring that for questions. So make sure if you have a question, it goes in that Q&A queue. We'll have time at the end, but we try to take them as we go along as well to make sure they're relevant to the conversation. Also, remember that you can subscribe to the podcast on iTunes or wherever you listen to podcasts. We always post a recording of the episode by the end of the day. So you can look for that as well on our website at thinkrevivehealth.com/COVID-19, where you will also find all kinds of other great content that we've put out over the last 6 months. It's hard to believe that September is this weekend. That is kind of insane. But all kinds of stuff, studies, research, content that will be helpful along with recordings of the show. So with that, it's great to have Andy here. Last week, we had Mark Fredson from UCSF Health out in San Francisco, and we spent the show really talking about marketing departments, marketing communications staff, and what they're doing to try to get through this environment in terms of taking care of themselves, being resilient, gaining support from organizations, what organizations are doing to support them. So I think this is a great transition because Andy's here to talk to us about how he and his team, the marketing and communication folks at Piedmont Healthcare, have really been leveraging this crisis in the best way they can to elevate the perceived value and credibility of what they do in the organization. And we have touched on this before because we see a real opportunity here because of the need of our organizations for marketing and communications to step forward. We already know that what Andy does, if you're not familiar with Andy and his work, or Piedmont, they're already out there ahead of many health systems. We have kind of celebrated the work they've done over time. And that continues. So we knew that you guys are already leaders, Andy. So I think it's great to kind of hear from those who are at the head of the class in terms of marketing as it is and how you're kind of getting through this crisis in a different way, in a better way. So let's just start kind of high level and talk about your situation there at Piedmont Healthcare, maybe broadly how COVID has hit in your area, what you guys have done overall as an organization, and then we'll dive a little deeper into marketing and what you've been doing in that respect.
Yeah, I'm laughing because we're based in Atlanta, Georgia, which has been really popular lately in winning a lot of COVID competitions. And, we were tied for number one in terms of number of COVID cases per capita. Now tied with Florida, right? And now we beat Florida. So go Georgia. And thanks for making our employees really stressed out. So at a high level, yes, we were known a few months ago for being brave and praised. This is not a political podcast, right?
We get there sometimes, but
okay. I'm wearing the Piedmont logo. So, let's just say that we were praised for being one of the first states to reopen. And I think that whether or not that's the right decision, the fact that people have not been as closely following the safety guidelines really hurt us. It cost a lot of lives, obviously. And, it's gone to the point where we had to open up a remote location to triage your COVID patients. Thankfully, it hasn't been that full. And then a lot of coordination with the state to make sure that we try to take care of as many people as possible. And we've also joined forces with our quote unquote competitors, Emory Healthcare and Wellstar and Children's Healthcare, Grady. We've all come together to kind of pitch into a safety message, just to really make sure that people understand COVID is easily spread, and et cetera, et cetera. So to kind of answer your question in a super long way, get used to this, by the way, everyone. But we're at a high level, we've definitely been impacted in a not positive way, but thankfully the numbers look like they're going down, and we hope that it continues to do so.
Yeah, I think that's really helpful to hear that. And everybody's going through this in different ways based on where they're located. But pretty much everybody's going through it at some level. So, unfortunately, Andy, you guys have gone through it at a level that many haven't experienced, but that also, has forced your organization or allowed your organization to step forward, maybe in bigger ways than others have needed to. So let's kind of talk about that a little bit. So when we were talking about, where we could go with your contribution to this show, and again, I set you up as somebody I think we look to as a leader in many ways, in terms of valuing the consumer experience and marketing's role in that, and how you use data and in many different things. Talk a little bit about what your marketing team has been doing just overall over the last, again, whatever it is, 6 months, 7 months of this crisis. And then we'll go a little bit deeper from there, but let's take it down to the marketing level.
Yeah. So I'll kind of give it in a timeline, weird, parallel universe type of thing. COVID strikes, and first thing we do is try to focus on the safety of our employees and our patients, number one. And so we have messages that are going out about safety precautions that we're taking, while still trying to understand what we should even do. But it's shutting down elective procedures. Don't come to the hospital. If you have to come, then you look up the link onto the website to see if you can bring a guest or not, and constantly update social media, respond to questions on social media, respond to calls about COVID symptoms. Symptom checkers were all the rage. And so it was really just getting the word out there from a safety standpoint. And then once the numbers started to go down the first time, it was, all right, we can reopen back up. Let's really push out virtual visits. So that's an alternative, which we got up in a matter of weeks, even though we've been struggling with that for years, right? And second is, it's safe to come back to the hospital because we have taken every precaution possible. And so how do we, from a marketing standpoint, how do we communicate that? Hey, don't delay your care. If you have a serious condition that your doctor says you need to come in for, come in. And so it becomes a revenue game. Like, how do we get back our volume? How do we get back our revenue? and how do we understand what drives people to want to come and who wants to come versus who doesn't want to come, and try to just get as much data as possible. And then the third thing is now it's a combination of both. Now that we're back, the numbers went back up. It's please be safe, wash your hands, wear a mask, watch your distance, the 3 W's as we call it. And now, in the meantime, don't delay your care. So we're in phase 3. And it's really tough to go against our baselines because there really aren't any baselines with this type of thing. But it's very, it's a lot of trial and error. And the one thing that's been made clear to all of us is let's fail fast. Let's expect to fail, but fail fast, and just keep trying stuff and see what happens. There's no blueprint. There's no game plan for this stuff that you can look back on. It's just, let's see what happens. So.
Real quick, I want to follow up on kind of the way you described it, because it really did go for many people like you described. Hey, it's a shutdown. It's all about COVID safety. Elective surgeries are off. And so there's a very singular focus. And then starting in May, I'm sure with you all as well, reopening, still talking about COVID, but everybody thought like, okay, that message is going to kind of stay secondary because we got to get folks back in, not anticipating going back up. And unfortunately, as you described at the outset, Georgia, along with others that opened quicker, saw an immediate surge. And then you have to kind of juggle both. Can you talk just a little bit more about that challenge of, hey, we're still open, but things are really bad. So, it's kind of like you have to deliver both messages at the same time with the same degree. And that's got to be challenging.
Yeah, it's like telling your kids, you're in timeout for 10 minutes, but I love you. Like, you're really misbehaving, but man, I really, really love you. It's like, what are you doing? Like, I'm doing this out of love. But anyways, so I don't think our message is that strong, but maybe it needs to be. So yeah, here's what we did. There's this, once in every 20-year thing that happens, right? The last time something this massive in terms of the marketing world was that I could think of, at least for my working life, was 9/11. Mm-hmm. And that everything, it wasn't for this extended period of time, but things just shut down. This time we shut down things. When I was around that time, I was in California, and just I remember like looking at the stars because the airline industry was just dead, right? Like they weren't flying anyone. They were just, but that happened for a few days. This time it's been weeks, and especially for the hospitals, it's weeks and weeks and weeks. And so in terms of a balancing act, it's kind of like an opportunity is how I see it. It's how do we get out a message to show that what we're doing is actually effective now that we have a clean slate. So you got the safety message component. All right, how do we know what we should be saying? So we have a weekly survey that goes out to patients, actually. We saw that there's a bunch of surveys out there, and some of them are national, but none of them are really for our own service area. And like I alluded to earlier, like using data from states like New York is clearly not where they've, got it together. Using sample sets from New York is not going to be really relevant to us. And so we just launched our own weekly survey. And again, flip that into an opportunity. Like, okay, now we know the patient sentiment of coming to an office versus coming to a hospital versus why and what they're comfortable with, and how do we turn that into a message of both safety and revenue, frankly. And then third, what we did was use that for content to try to attract as many referrals as possible by sharing it with the doctors in our areas. Like, hey, this is what your patients are saying. Here's what we recommend you do. And so we kind of balance both safety and revenue. And again, we have a clean slate. And so now we try this thing and we can measure the results of that thing right? Without any other noise. There's no other, we don't have to index anything. We have no media in the market. We have like our digital ads are pretty much shut off. We only had paid search and organic social. So we have a very clean slate, and so we know exactly what can work and what can't work. And so the balancing act really comes into the results, right? So we know this, the COVID numbers on a daily basis are going down. So whatever we're doing as a state, as a hospital system, we're going to keep doing that because we track that without any other noise. From a marketing revenue and volume standpoint, again, nothing to really compare it to from a year-over-year standpoint or a baseline standpoint, but it's a clean sheet. We turned this on and then this happened. We turned this on and then this happened. And so it turns into an opportunity for us to figure out not just how to figure out what the balance is, but also how we could show what the value of marketing is overall. And so it's been a really, a terrible word choice here, but this is a podcast, so anything goes, right? It's been a once in a career type of opportunity for us to really prove why marketing is important, especially in times like this, and especially in normal times, frankly. So
let's talk more about that.
Yeah.
Let's talk more about that, because I think it is tough, right? In we have said this too on this podcast and in other forums, that there is an opportunity here, maybe unprecedented for us in marketing, to really show the value we can bring because of the dire situation that our organizations are in. And they are turning to marketing because they're, they being the hospital leaders, in many cases health system leaders, are desperate for anything to help fill things back up, even though most folks now are saying, well, we're back up to 85, 90%, which is fantastic when you're at 0 or 10, but nobody's going to be able to survive long-term at 90% in this business, right? So the opportunity's tough, like you kind of spoke to it, because we're in a horrible situation. People are dying. But that still, how do we do that? And I think that's where we want to dive in with you, because it sounds like you've really taken on a perspective, Andy, that, look, we really need to step forward and fill this void. This is going to be our best chance to show people what we can do. So talk maybe a little bit about that perspective, and maybe how you've done that in some concrete ways.
Absolutely. So every other job that I've had in my career, whether it was with AirTran Airways or Southwest or UPS, marketing was seen as the revenue generation arm. We are not an expense, or we're not a cost center. We are an investment, and our CMO, Dow Bergsma, also is very good at this. And my previous boss, Matt Gove, who I know you're very close with, and probably everyone on this podcast probably just smiled at. He thinks the same way. We're here to bring in patients. And I know a lot of the perception that other health systems face, and frankly ours too in some regards, is we're a cost center that generates biocards and collateral, right? And appeasing doctors from an ego standpoint sometimes. But that's part of our job description, but at the same time, that's not why we exist. And I've been working with Matt Gove and now Dow to try to change that perception by really showing what marketing brings to the table in a financial sense. It's at the end of the day, it's about dollars and cents. And so what is marketing doing to bring those dollars and cents in the form of people to the table? And so, we did a clean slate, like I said. And we were able to convince through our CMO, we were able to convince our CEO that, hey, maybe marketing shouldn't have budget goals as part of our annual incentive plan, and even online scheduling or even net promoter scores. I mean, that is important, right? But for this quarter, we're exactly aligned to the rest of the physician enterprise in terms of annual incentive plan, and that annual incentive plan is tied to net operating income and volume, and that's it. So now we're being held accountable to those two things only, nothing else. And the conversation at the top changes. It's not hey, Dr. So-and-so is pissed at you, Andy, again, because you didn't do this Facebook ad for him. You said no. Now it's, dude, our numbers are down 5%. What are we doing? Because, hey, my bonus is on the line now too. So what are we doing for increasing our primary care volume for this quarter? Where we need, and we have those goals very clearly laid out. We need 259.7 thousand visits just for our low acuity. We have 57.7 thousand visits for our quarter for our heart. Like, those are the numbers that we're tied to together and that we're reviewing on a very, very regular basis, more than weekly, to kind of, again, change that perception and make them realize we're here to drive business. We're here to drive patients. And these are the numbers that we're both tied to. So let's talk about those. Yes, we'll get the bio cards done. Yes, we'll update the website. Yes, we will, do these other signs and posters. Great. We've always done that. We'll keep the lights on. But at the end of the day, we're here as an investment, and we're going to bring in a return for that, and we're going to quantify it. And that's how we need to be. That's what we need to be talking about. Not how do we make Dr. Bevelo so happy?
You still need to do that, Andy. Don't leave me on. So I'm gonna.
Are you even a doctor?
No, I play one on TV. There's a question. There's a lot of questions coming through, but I'm going to pull one out because it's directly related to what you just talked about. This is always a challenge for marketing, but the question is, how are you directly tying what you're doing to those volumes? And then hopefully further down the line, contribution margin and financial return. So it's causation, not just correlation. How do you answer the CFO? Because that's who always seems to ask the question. They would have come otherwise. This is great, Andy, but they would have come in anyway. How are you able to answer that?
Yeah, and you know what? A lot of them would have come in anyway. That's the reality. So what are we doing from an incremental standpoint to show that what we're doing actually matters? And so this is, going to be a dead horse a little bit, but we have nothing else in the market. Now we just sent out one email to this group of people promoting virtual visits or COVID antibody tests. Look what happened to our volume that day and the next day. This is what was last week, right? I wish I had some paper. Well, I do have paper, but it's a podcast, so really pointless.
Just gesture, it's fine. Gesture.
Yeah. All right, everyone driving their cars and their podcasts, do not try to visualize this and close your eyes. But you have a curve last week or the last month, and now we sent one email out, and the curve looks drastically different on that same day. That's incremental, in my opinion. I wish we could show year over year. Maybe we had a huge bump the previous year, and we can pull that data, but most likely we didn't. There were a lot of other things going on last year too. And so we send one email out, and every time we send an email out, our volume behavior patterns drastically change. And so, you know what, we're going to take credit for those appointments from a marketing standpoint. And we know this email, through tracking, we do a lot of tracking, and this email generated not just the clicks, but this many appointments. And those appointments, let's call it $100 worth, and we did 1,000 appointments that day, right? That's 100 times 1,000. $10,000. But
more.
Yeah, no, 100,000. Oh my God, my dad's gonna kill me for not doing that. And I am Asian, for those of you on the podcast, so don't judge me. But yeah. Point is, we have very, very direct causation that we can prove. All right, emails work. Let's send out more. Let's keep the emails going at a good cadence. Now we know what to expect. The spikes to happen. The call centers got pissed at us, like, dude, what did you guys do? What a great complaint to have. I remember those complaints that used to come in my old jobs. Like, man, you didn't tell us about this email. Oh man, did I cause your agents to create more work? I'm really sorry, but yes. Then we'll do like a paid social ad, and we can track any bumps from there. So yeah, we track everything from a causation standpoint, because again, we had a clean slate. And the only thing that could have possibly caused that jump was an email that we sent, because we did nothing else that day, and therefore we know it works. and we can quantify it. We quantify it down to the appointment, and then we put an average dollar figure per appointment and multiply it out. Boom, ROI.
So let me ask you a follow-up question on that, because I've seen this approach I'm going to lay out for you work successfully to different degrees. It's not, you can't always do what you're talking about to tie it through directly. A lot of times, to your point, there's a lot of things going on. It's hard to know the impact, and ultimately you want some kind of marketing attribution model. But I have found that if you can prove it 1, 2, 3 times, then there's a certain number of times you just have to prove it where people go, okay, so I get it. You're having an impact, and they don't question you beyond that.
Yep.
Do you find that's true, or to what degree do you find that's true? That you
Yeah.
just need to prove it enough times to be able to move forward with all the things you want to do.
Yeah, and be transparent. Yeah, rinse and repeat. And we try to democratize our data from the marketing standpoint, where we share results as often as we can. And you know what? We'll tell them what doesn't work. High acuity consumer marketing doesn't work. But we'll tell them what doesn't work. And sorry, and then they'll say, well, the creative sucked. All right, let's change the creative. Let's try it again. And so we do a lot of rinse and repeats and lathers, and again, just try to be an open book about all of our results at any given time. And also, something that our CMO Dow has been very good about is making sure that our numbers match what they see on their end. So we have an insights and analytics team, and their numbers match exactly what our physician enterprise sees, what our finance team sees. It's the same numbers, and we compare it against our monthly dashboards and our monthly balance scorecard. It's the same number. So there's no question about the data either. So hopefully one day we'll forget to tell our ortho folks that we sent out some kind of B2B campaign, and they'll be like, hey, did you guys do anything yesterday? The numbers really jumped up. Like, yeah, we saw the same thing. Sorry, forgot to tell you. That's the kind of conversation we hope to have, not where's my bio card.
Right.
That bio card, man, is the death of everyone here. But
well, let's talk about that, because
yeah.
you're being very clear about focusing on driving volume. There's a lot of ways we could come at this, but if you're prioritizing in such a way, are there things that you're deprioritizing, or just saying, you know what, we're just not going to do that anymore, or we're not going to do that now because it's not a priority? Are there things you can point to that you've taken off your plate?
Yeah. So community sponsorships, right? We're like almost every other industry, not Amazon. But we financial struggly, that's a word. You heard it here first on the no normal. That is a no normal word.
It's good.
Struggled financially. That. Oh Jesus, this is recorded. No normal. So yeah, we are struggling financially. We struggle financially, and we have to be really, really smart and responsible about the resources and be good stewards of our patients' money. And so we actually stopped a lot of our sponsorship deals that we did in the past for many, many years. Turns out we're a pretty large system, so there's over 160 of them that we said sorry to. Did we reinvest some of that money for things that we know had just a direct return? Yes, but most of that we just stopped because we had budget cuts like everyone else. So those, even down to the $100 level sponsorship of kids, youth sports league. It's only $100, but we have a lot of those. And those things really do add up. And we just said across the board, we're just going to stop it all. Our CMO went to our leadership team with all the other CEOs of the hospitals and said, look, I'm going to make this list public. This is what we're just going to stop all of these things. And if you have, and our CEO was the one that had this idea, if you have a problem with this sponsorship, then talk to me about it. And guess what? No one really talked to him about stopping their kids' $500 school sponsorship. And yeah, again, we couldn't show a return. If we wanted to, man, that would be a lot of work to show a return for a $500 investment. But anything like that, we just stopped. Yeah.
Okay, that's a great example. Do you see that as something that might be a permanent change? Is that something that is specific again to kind of the crisis situation we're in, and it gives you the opportunity to do things that otherwise you might not have been able to, right? Like,
Yeah. Once things go back to normal, if that ever will happen, I could see those requests coming back.
mhm.
Um, and we are a support of the community, and so I think we're going to have some level of community involvement again, and we should. But how it's assessed and how it's going to be prioritized will be very, very different than, hey, I'm just going to slide this sponsorship form your way. It's only $100. Can you do it? It's going to be a lot more strict than that. I can promise you that. And every dollar that is invested in marketing has to show a return, including my salary, my team's salary. Like, what is Piedmont getting out of it? So.
Okay, so I want to get to some questions because we got a ton of them. A couple of quick ones, just kind of logistical.
Oh my God, 725 questions.
I know we won't get through all those.
Oh,
How many
Lord.
people on your marketing team?
34.
Okay, and
That
that
does not include
Good.
PR and internal communications. So that overall, it's about 50, 55, I think.
Does that include the experience group? Because I know you guys.
It does not. Yeah, no, it's separate.
How big is that group?
That team is roughly 8 people. And then there's a lot of dotted lines into that team.
Okay. Can you roughly estimate the overall budget split between consumer-oriented marketing and B2B? So physicians,
Yeah.
employer, whatever else.
Yeah, this is a topic I love talking about, as you know, Chris. The funnel, the Matco funnel.
Yeah.
Yeah, it used to be 80-20. Well, so let me put it in context of the funnel. Copyright TM, Piedmont Healthcare. Just kidding. So patients start into your system and form a relationship with your system, starting with low acuity, and then the low acuity docs then refer you to the high acuity procedures, services, surgeries, etc. And so a B2C marketing approach to high acuity services doesn't always work. I'm not saying it's 100%, but or 100% confidence, but we do know for the vast 89% of our patients, most of our high acuity new patients come through referrals and not consumer advertising. So that being said, B2C for us is more about low acuity services, primary care, urgent care, quick care with Walgreens. That's what we spend most of our B2C money on. That used to be 20% of our budget. Now it's closer to 80. So we actually did a flip flop, whatever.
It's the no normal. It's
no
the
normal
now.
No,
So you did not mention in the top of the funnel when you just ticked it off, but this is related to another question, virtual care. So it sounded like you, like many health systems, I mean, some of the numbers we see are almost unbelievable, going from 0 to 70,000 virtual visits in a month. They're going from an average of 25 a week to 25,000 a week. Like, these things are just insane. It sounds like you guys also had a nice bump in that. How much did you market virtual visits, or did you?
We marketed it a lot a few years ago. The numbers sucked. It was could our customers, patients, consumers, whatever, could they have had a better experience on our virtual visit app? Yes, 100%. But the amount of promotion that we did, and the amount of adoption was god awful. It was just terrible. Now, and then that was just for that was for a white label product that we used, and patients not seeing their regular doctor. This was just literally on-demand service. Now we've switched our existing and employed docs to virtual visits, in addition to on-demand services, and the numbers, let's just call it in the tens. per month to the tens of thousands a month
Yeah.
because of COVID. And all we did, like I said earlier, we didn't do anything except for an email and social post. And that's all we did. No TV commercials, no traditional media, no digital ads. It was just, hey guys, we're pushing this out. We think this would be a good thing for you. And to the doctors, hey docs, we think this would be good for you because patients, based on the weekly survey, are telling us this is something that they would do. And now it's turned into just a normal way of life. It will never be as popular as the in-person visit, but you know what? It's a great alternative, and it's a generational thing too. People like Chase's age, you know, the mid-20s, they love that stuff. And the people in the Chris Bevelo's age, you know, they're a mixed bag.
Don't do that. Don't do that. I'm not a mixed bag. I'll tell you what, Andy. I prefer a virtual visit 99 out of 100 times. I'm telling you, man.
Guy ever.
I have been through this,
boomer.
And it is like not even close. Why in the world would I want to drive to a doctor office, sit there, read the 2014 copy of Golf Digest, wait 45 minutes, see a doctor,
sneezed on,
right, and then drive all the way home when I can do all that in the comfort of my domicile.
With many books I see in your back.
I could read one of these books. I could play a video game. I could do all kinds of fun stuff.
You can read your 2014 Golf Digest at home.
I could do that. You're right.
But yeah, and you know what the numbers show is adoption was really hard, and it still is hard for the older crowd. But once you do it once, God, I'm so good with words today. I'm so glad I'm doing this today with you guys. But once you do it, you are much more likely to come back. And so on average, people tend to use virtual visit services more often than they go to see their doctor. We saw a 3x increase actually. So driving all the way to your doctor's office, which is probably by your work, and of course you're not going to work that much, versus just do it on your phone. And that huge barrier has just been removed. And so you're likely to do a virtual visit again and see your doctor more often, which means more revenue for us. And so, yes, we are promoting it mostly through digital channels, and we did it only a couple of times. That's all it took. All right, we have 732 more questions.
I know, and we're not gonna get through them all. Let's wrap. But you know what we do is we take any questions that weren't answered, we'll forward them to you, and then that way you can get back to folks who've got questions. But it's a good time to wrap. Like also, that was a great, some great stats there at the end for virtual care, because every time we talk to somebody, we learn something new about that. And the 3x in terms of people extending the volume of their interaction, I think is such an important thing to keep in mind. That's what this allows. It allows more. So that's just beneficial all the way around. So Andy, knew this would be amazing. We learned some new words, but more importantly,
of course it's amazing.
We got some great insights from you. I think we're going to have you back. Are you open to coming back?
Yeah. Happy to be back. Happy to be here. Big fan of yours. Longtime listener. So, this is an honor for me.
Well, great. Well, thank you so much for coming on, and we will definitely have you back. Chase, thank you, sir.
Absolutely.
Chase, let's write a book together so that we can outsell Chris. Let's call it.
That's not going to be hard.
Bio cards suck or something.
I'm all for it.
You guys go do that. That would be great. We need that. All right. So thank you everybody for joining us. If you've got something you want us to cover, let us know. Put it in the chat channel right now, or send us an email at nonormal@thinkrevivehealth.com. There's so much we can cover. We want to make sure what we're talking about is relevant to what you all want to hear. Remember, we post a recording of this on our website at thinkrevivehealth.com/COVID-19, COVID-19. By the end of the day, you can subscribe on iTunes or anywhere else that you subscribe to podcasts. We'll be back next week. And until then, good luck out there in the no normal. Thanks for joining us.